Thank you, Naushir. Thank you, Hoya, for inviting me to be, here for this particular important session. Well, this talk is about my early experience of Nanex Multiser. Now, Nanex is the new baby in the Hoya basket. Now, ophthalmologists today are spoiled for choices. Lens technology has matured in every aspect in offering best of the features in both monofocal and multifocal platforms. But when it comes to choosing your lens, we look at ease of implantation. We look at the size of the wound needed to insert a lens. We also look at long-term stability of the lens in the eye. And obviously, we look at long-term PCO retardation properties. Well, talking about among the preloaded platforms, Hoya has proven to be one of the favorites in terms of comfort and incision friendliness, which was mentioned by the previous two speakers. Now with Nanex Multiser lens implantation system, the Hoya have taken it to a new level. All of us know that with available technology to perform phaco through 1.8 millimeter incision, Nanex Multisert fills the unmet need of an injector system that can deliver through a sub 2 millimeter wound without stretching it any further. Now, that is a very significant step that Hoya has achieved. Well, I have no financial interest, but this is what the Hoya has done. Now we have different preloaded injector systems. A preloaded system, as it was mentioned before, it reduces the instrument's touch during preparation, which helps to reduce risk of bacterial contamination. There's absolutely no chance that forceps may scratch the IOL optic. And there's always increased predictability and consistency of lens delivery. Now we come to the product that I'm talking about, and that is Nanex Multiser. Now this lens obviously is a hydrophobic with UV filter. It's 6 millimeter by 13 millimeter. It has an angulation and it goes through the injector whose outer diameter is around 1.62 millimeter. So effectively, through an incision size of 1.8, this lens can be easily inserted. Let's look at the PCO overview. According to some studies, the overall incidence of all forms of significant PCO requiring yaw capsulotomy is nearly 12% or more within 5 years. And the rate is, however, significantly greater for younger patients and can be affected by the lens that we implant. Now, Hoya has its own triple approach, which was said in the first talk by Dr. Kumar. It is an edge design, hydrophobic acrylic, but what's interesting is the oxygen processing. And they call it active oxygen processing, which is a simple and highly effective method which improves the wettability and the adhesion of posterior surface of hydrophobic acrylic lens. Now, this treatment in combination with the other two is effective in significantly reducing the PCO rates. This study done shows you that active oxygen processing treatment can significantly inhibit the PCO formation in a treated surface in comparison with untreated surface. This is an Nanex IOL material with a surface which is treated with active oxygenation, whereas this is an IOL material without the surface, and you can see a significant increase in the thickness of LEC proliferation on the central posterior capsule. Let's come to that innovative design of Nanex Multiser, which allows surgery through sub 2 millimeter incision during cataract surgery without compromises. Talking about wound protection, there's a minimal wound stretch because this particular nozzle has the smallest size, which has an outer diameter of 1.2. The delivery consistency and smoothness is outstanding, and the predictable lens release afforded by Hoya's unique patented preloaded IOL delivery mechanism proves it. Now, this particular injector is called a 4-in-1 preloaded IOL system, which has a push or screw injection and insert shield in advanced or default position. Now, what is it? Let's see in the next case. Now, this is a uniquely single-handed push or two-handed screw injection within one device. This is where you're using single-handed push technique to insert the lens in. And if you're used to using a screw technique, this is how you hold it with one hand and very gradually with the second hand, you can screw it in. And the other two features are about how delivery can be done directly into the capsular bag, or it will be done through the incision wound. So it has got an insert shield, which by default position, it is at the back. So the entire nozzle can go through your incision and literally the lens is placed in the back. But if you are not used to that, or if you are comfortable using it only into the wound, then the shield is brought forward so that that shield prevents the nozzle from going further. Now let's look at this case. First, you inject viscoelastic to fill it. Then you remove the cap. Then you forward the locking mechanism and take it out. And this lens can either be used with a plunger pushed forward directly. And the beauty of this nozzle is that it goes in directly. Now here the shield is in the default position and the lens is directly getting placed into the bag, and the material is such that it unfolds so comfortably that it's so very repetitive, so very precise. And mind you, this presently it is done to 2.2, but you can do it with equal ease even through your 1.8 incision, provided you have a Pco ability to complete your Pco with 1.8 incision. Now, why it is so? Protecting the sub 2 millimeter incision quality through world's smallest nozzle tip of an open loop preloaded hydrophobic IOL design is what Hoya offers us. And when you compare the nozzle size comparison, the Nenex as compared to most of the others that are available like Ultracert, Technics, iTech, Rayon hydrophobic, it's the smallest one where it is 1.62 millimeter outer diameter. And that makes it possible to insert it comfortably. And why it is important is highlighted in this study. And mind you, this is very true. In this, Nenex Multiser is used through a 2 millimeter incision as compared to some other lens. If you look at this blue segment, which is wound stretch by the IOL implantation, there is almost 51% reduction in wound stretch, because wound stretch is a reality. That you can see in the last one, where you have two of the well-known lenses, where the wound stretch is almost 0.32. That means if you are using a 2.2 millimeter incision, the final size of the incision becomes 2.56 or 2.62. Now, this is not an exaggeration. because we rarely measure our wound at the end of implantation. The wound stretches to become so big. So if you have a nozzle which can go through without stretching the wound, it is always wanted. So in conclusion, Nanex lens and multi-cert injector system is a new member in the ever-expanding group of lenses for us to try and enjoy the ease of comfort and long-term stability. Thank you so much.